Hi, guys. So, you know my voice, but not my face is Dr. Belinda George. And most of you are familiar with me going live on for bedtime stories, but this is the doctor that I've been talking to a lot. So, this will be an interactive session. So, as you come on to the screen and as you watch this later, because it'll be saved on the pages, you can make comments, and so your comments or your questions will go into the onto the screen. And Dr. Brian, when he has time, and if he has time, he'll answer. All right, Dr. Brian, the stage is yours.
Okay, thank you. So today we get to talk about one of my favorite subjects, I guess, one of my favorite minerals, definitely, which is magnesium. So some people call magnesium the forgotten mineral. So the question is, why is that? Well, it's because we think about things like potassium and sodium quite frequently. And it turns out that even your regular lab tests, the routine lab tests, don't necessarily routinely measure magnesium levels. So it can be easily forgotten, and sometimes even the doctors. So we'll be able to talk today about magnesium, and let's see. On the next slide, you'll see some of the things we want to cover. So we want to be sure that we cover, who should supplement magnesium, and how do you know if you're deficient in magnesium? What does magnesium do in the body? How does it affect overall health? And what form of magnesium should you choose? So these are questions that I get asked all the time. And so let's kind of go through it. So, all right. So it's kind of important in this day and age to talk about magnesium, and primarily because we're drinking so much water. The word has gotten out that we should be drinking quite a bit of water. So there are certain organizations that recommend something like over 2.5 liters of water for female, and over 3.5, almost 4 liters of water for men. So let's say an average of 3 liters per day of water, right? So not long ago, I was watching this show where there was water sommelier. The idea is kind of like a wine connoisseur, where they call them the wine sommelier. Well, there are apparently something like 100 water sommeliers. They've gone and they've received certifications on water. So, which actually, by the way, if that's an interest, that could be another topic of conversation. But one of the things that the water expert talked about was all of the different flavors of water, all the different minerals in water, and made an interesting comment that sort of stuck with me, which was water will find its minerals. So the idea that actually drinking pure water, lots and lots of pure water, is probably not the best thing for overall health. Well, so we have to think about that historically. So before we were drinking so much bottled water, we were drinking water that was mineral water, spring water from natural sources. It turns out that that was one of our best sources of minerals, including magnesium. So now when we're drinking purified water, in many cases, the water that we're drinking in the water bottles is actually has less minerals in many cases than our tap water. So even our tap water has fewer minerals than a lot of the spring water or the natural water. So let's think of it this way, that a source of minerals in our body, a source of nutrients in our body, is actually supposed to come from the water itself. Interesting, right? Well, so that if we're drinking pure water, not only are we not getting that source of minerals, that source of magnesium in particular we're talking about today, but it's actually drawing that mineral out of our bodies. So if you can imagine a situation where the water can actually sort of leach out minerals from our body. So if we're drinking 3 liters or 4 liters a day, we're patting ourselves on the back and we're thinking, okay, we did a great job. We drank our water today. We do it again and again, day after day. Not a bad thing in the sense that we're staying hydrated, but we have to think about consequences. We have to think about the question of whether we are becoming low in minerals. And then, well, that is important because now we have to think about, well, why is it important? Okay, so again, 3 of the most important minerals that we'll talk about generally would be potassium, sodium, magnesium, and maybe phosphorus. But it turns out when we sort of pee out all of this water, we're sort of losing the minerals. Turns out that's not a problem when it comes to sodium because we get plenty of sodium. We get plenty of sodium in our foods. In fact, we probably exceed our sodium, recommendations. Potassium, it turns out maybe half of people are deficient in potassium and similar numbers of magnesium. So, all right, so magnesium is, of course, found in multiple foods. So if you read online, you'll read about things like bran and nuts and avocado and mackerel or other fish. Turns out there are lots of sources. Even meat has good sources of magnesium. Sometimes those sources are based on sort of by weight. So it may look as though the meat has less, but we eat more meat by weight than we do wheat. So we do have sources of magnesium, right? But again, we're not getting enough if we're relying solely on our foods and if we're potentially sort of leaching it out when it comes to water. Also, certain medications can lower our magnesium levels as well. So this is only important when we think about, well, what does magnesium do, right? How is it important? So it's been estimated that up to or over 300 biochemical processes that magnesium is involved in. So over 300 processes in the body. Well, turns out that some of those processes are related to energy, or hormones, inflammation. So if we really broke down every process, I think the number is difficult to measure, right? That important. So it turns out that when it comes to magnesium, it's important in first of all, let's say it's stored in the bone. About half of the magnesium in the body is stored in the bone. The other half basically is stored in the other body tissues. Let's say the soft tissues of the body. So now imagine bone, okay, half of the body's magnesium. Other tissues in the body, okay, basically the other half of magnesium, except for 1% of the magnesium in the bloodstream. So 1% of magnesium approximately is in the blood. So how do we know if we're deficient? Well, the first thing we do is we check our blood levels. So let's say that you go into the doctor and you get your labs and you say, well, everything's okay. The doctor told me everything looks fine. I had a pretty good, checkup on my physical. Well, that panel may or may not include magnesium. It's actually not in most of the standard panels. But let's say it is included. When it does include magnesium in a more comprehensive panel of electrolytes, there's a range. So that range is generally determined by the percentage of people in a population. So again, that 1% in the bloodstream is generally determined by patient population. So let's say that a range was between 1.5 and 2.5, depending on, well, if that is the range, and if your level was 1.6, you're still in range, but there's a big difference between having a level of 1.6 and a level of 2.3. So the thought is that a person can be body magnesium deficient without necessarily being deficient in the bloodstream at times. So it's important to keep in mind. So as this slide sort of mentions, yes, it's involved in the bone and sort of muscle function, nerve function, heart. So one of the things about magnesium is that it is related to relaxation. So we can think of that in a couple ways. Let's think about a cell that fires, that triggers, sort of an electrical firing. So calcium moves out of part of the cell and sometimes out of the entire cell, and magnesium moves into the cell, or it blocks the channel. So when magnesium does that, the cell relaxes. So in the case, for example, of muscle, magnesium is a muscle relaxant. It's actually a natural calcium channel blocker, which lowers blood pressure. and a natural muscle relaxant. So if someone has muscle spasms, I think back to growing up in Birmingham, Alabama, my grandfather would use Epsom salts, right? So you take a bath in Epsom salts and it relaxes the muscles. So it turns out Epsom salt is really magnesium sulfate. So you're bathing in magnesium, and it turns out that that magnesium actually penetrates through the skin into the body, calms the body, relaxes the muscles, helps with spasms. Enough magnesium actually lowers blood pressure, which is interesting, right? Because it turns out that a lot of times a person can have a high blood pressure that responds to replacing magnesium, and now the overall blood pressure has improved. So some studies that I saw suggest that the supplementation with magnesium is as effective as sort of an average blood pressure medication, an average blood pressure pill. So at Balance Wellness Center, our goal is always to treat the root of the problem. So when it comes to high blood pressure, one of the first things that I always want to do is to be sure that someone's magnesium is replenished. Okay. So that relaxation, that muscle relaxant property of magnesium is a big one, right? Inflammation. So inflammation is also quite important, obviously. So now we learn that more and more diseases that we know of are actually triggered by inflammation. Diseases that we didn't think were before, like even heart disease, right? Even atherosclerosis, right? The blocking of the arteries. So in other words, even heart attacks, strokes, even Alzheimer's, all of these have this inflammatory component that triggers the disease. So it turns out low levels of magnesium, now we say, oh, okay, it's associated with this, it's associated with this, it's associated with this. So the goal is to balance the body and have the right amount of magnesium. So we could go on and on, actually. We can probably talk about every organ in the body and the role of magnesium, but another bit about inflammation. So when it comes to inflammation, one of the hallmarks of inflammation is that it's also quite associated with low vitamin D. Well, it turns out that magnesium is necessary. Magnesium is needed for vitamin D to have its full effect. That's another thing about magnesium. It actually helps other chemical components to work properly. So I'm a big advocate of vitamin D replacement for anyone with autoimmunity. So that's certainly another topic, because we could talk for quite a while about vitamin D. But the point is that even if we're taking the right amount of vitamin D, that magnesium becomes very important, because you don't want to have magnesium deficiency when you're trying to treat that root of that issue. Autoimmune conditions include everything from eczema, psoriasis, to thyroid disease, to type 2 diabetes, to really it's just all a host of things, lupus, rheumatoid arthritis. So again, this is why I kind of consider, many people sort of term it the forgotten mineral, because we tend to treat the sort of the disease process rather than treating the root of that particular issue. It's related to hormones. In this particular slide, it mentions sort of menstrual things, but it actually is related to essentially all of the hormones: the estrogen, progesterone, testosterone, thyroid function, the activation of thyroid. So low magnesium levels, if not addressed, well, first of all, they accumulate year by year. So little bits at a time. So if someone's, let's say hypothetically that you had, you consumed, pretty good, you consumed 95% of the amount of magnesium you're supposed to take in a day or in a year. Okay, not a problem. So that means that every year you're 5% deficient. So that adds up, so that the older a person gets, the more deficient sort of they become. But the older a person gets, the more it's not just a level that we're talking about, it's actually sort of symptoms. Okay, and sometimes those symptoms we sort of diagnose them as illnesses, right? So it's good to treat things at the root whenever we can. Okay, so autoimmunity is it's quite common and it's quite unfortunate because some of those factors can be reversible if we take the right actions. So some people recognize magnesium from pregnancy. So maybe thinking about the idea that, okay, pregnancy, oh yeah, in preterm labor, so let's say instead of 40 weeks, someone is in labor at 34 weeks. So magnesium actually slows down those contractions and prevents that early labor, prevents those contractions. So high doses of magnesium are actually used in those cases. Higher doses of magnesium are used in preeclampsia when someone's having extremely high blood pressure around the time of pregnancy. And so very high doses of magnesium are given. Now, since I mentioned that, it's good to talk about safety. In general, magnesium is a very safe mineral. So when you're taking over the counter magnesium, if you have relatively normal kidney function, then the magnesium is easily balanced. And so we don't particularly worry about the dosages there. But in cases of extremely high dosages or extremely poor kidney function, it can be a problem. The typical side effect would be too much relaxation, which could reduce blood pressure, um, dizziness, lightheadedness, or that type of thing. But it's quite rare, actually. So we have a sizable percentage of the population that is deficient. But again, the entire population of people sort of keeps moving lower and lower, then, well, the norm changes because you're still within that. The question isn't so much where you stand in that norm, but the question becomes how optimal is your magnesium in your stores. So another category of magnesium is basically energy. So, okay, it doesn't mean that we associate taking a single capsule of magnesium as feeling energy, but it's involved in all of the processes of energy and ATP. If you remember ATP from chemistry class. So there are plenty of you know sources, reasons for magnesium, and plenty of processes and plenty of categories which it works. So we come to a common question which is what type of magnesium should I supplement? And there are plenty of different types of magnesium, and then what dosage should I take? So typically, the way that we sort of answer that is almost by the side effects, if you will, or the favorable effects of that particular formulation. So, magnesium chloride, for example, tends to loosen the stools. So, enough of that, and a person has diarrhea. Okay. But if someone is typically constipated, then maybe that's a good source. Magnesium sulfate, we talked about the idea of with Epsom salts. Also, IV, it's an IV version of magnesium. Magnesium citrate, magnesium oxide. So it turns out that magnesium oxide is very common. It's a common, sort of inexpensive magnesium that you see, but it's sort of known to be less absorbed. So the percentage of the capsule, the tablet, that is absorbed in the body is lower, okay, than some of the others. So it's not sort of my favorite these days for a lot of supplementation. Magnesium glycinate is known very well for relaxing muscles, um, and sort of helping to fall asleep. So it's sort of a common recommendation for a bedtime magnesium. And then there's others. Another notable one on this list is magnesium threonate or L-threonate. That's an interesting, so that's a formulation of magnesium that makes it into what we call the blood-brain barrier. So there's this barrier between the bloodstream and the spinal cord and the brain that prevents things from getting into the circulation of the brain and the spinal cord. and only certain things can sort of make it through that, either by their size or by how they're charged. And magnesium threonate is the magnesium formulation that penetrates that blood-brain barrier. So if someone has issues like neuropathy or anxiety or migraines, by the way, that might be the magnesium of choice. That sort of helps. Um, so while not an approved treatment for migraines, we understand that the minerals play a role in this, the way the neurochemicals interact. Okay, so there are plenty of things and plenty of ways we can talk about magnesium. So it's kind of hard to, um, it's hard for someone to sort of go and sort of see a shelf of all of these supplements and pick one, right? So that's a good way of thinking about it. Which which effect or which side effect works best for you? So lately, the one that I've taken is magnesium glycinate. Taken at bedtime, it tends to help with sore muscles and tight muscles. So that's sort of typically my magnesium of choice. Although magnesium threonate is one that I've ordered personally, and for my clients and patients at the hospital as well, I typically kind of listen for those issues that they may have that may complement that particular magnesium supplement. So let's see. I'm going to take a look and see if we have some questions coming in. Thanks everyone for tuning in. Let's see. So there's okay. Here's a question from Jamie: whether or not to take a combination of magnesium and vitamin D for low energy levels, and if so, what kind of magnesium for low energy levels. So um, typically, I don't think of them necessarily as purely energy, although the vitamin D alone plays a role because of the role that it plays with hormones specifically, in helping sleep. And so I have had multiple individuals who supplement vitamin D alone and note improvements in magnesium. Magnesium, though, has a reputation for being a little bit more of a calming mineral, so that it's taken at night more often than not. Sometimes it can be taken during the day if you have a formulation that doesn't make you sleepy. It, in combination with the vitamin D, can help with energy in another particular way, potentially, I suppose, which is reduction of inflammation. If a percentage of our body's energy is being used to fight inflammation, then that's now freed up more energy to be used to give us more energy for life, for muscle energy, etc. Okay, so if that answers that question. Um, so
Dr. Bryant is a little delayed, so their questions may come a little bit after.
no problem,
So
no problem. So um, since we've started talking about hormones a bit, um, a question that I often get is, when it comes to hormone understanding, sort of whether we whether we are wise to supplement A or B or C. And this relates to the way that we talk about magnesium as well, because the way I look at it is my goal as a physician should be to understand where there is an imbalance and to correct that imbalance, right? So if there's a deficiency, to correct that deficiency, to understand why there's the issue that a person is presenting with. So when it comes to hormones and magnesium, it's about understanding what they do, it's understanding what levels mean, and it's understanding how potential symptoms or medical issues um, could sort of hide themselves and actually be these root cause issues, but not recognized. So when it comes to that, for example, estrogen is more inflammatory or more growth driven or more regenerative, maybe is a better word. Progesterone a bit more relaxant, and testosterone sort of a bit more go getter, right? So it's every one way to think about this is that these components have their own personalities. So if I were to give a classification or a personality to magnesium, I think it would be also that maybe balance itself, because it's so central to so many processes. Um, and so it's always rewarding if someone, for example, has insomnia and they realize, oh, okay, they can just take magnesium and feel better. Or if their blood pressure is borderline and starting to be high, and realizing, oh, okay, well, that's kind of reversed. Oh, wow. The same thing with some of the things like anxiety and such. Certainly the inflammation component. Okay, let's see. So okay, someone else asked the same question about taking them together. So the thing about, it was about potassium and magnesium together. So they're okay. So the thing about potassium is it's one of those that we don't generally recommend for a person to supplement without knowing what their potassium level is. So without knowing something about their medical history. So potassium has to be monitored very closely because the imbalance of potassium can cause heart rhythm issues and can cause major issues. And so too much of it can be a problem. Magnesium we have much more leeway with, right? So that's that's perhaps the best answer to that question. If you have been prescribed potassium by a physician, and especially if you continue to have a low potassium, then magnesium works very nicely as a supplement with the potassium. One of the things I don't know if I mentioned was that magnesium is necessary for other electrolytes to actually be absorbed, and to be maintained, I should say, in the body. It helps to prevent losses of other electrolytes through the kidneys, through the urine. So um, if someone is, if you go to the doctor and you're always low in potassium, or you're on a diuretic and you're always low in potassium, or if you have to supplement potassium because you're always low in potassium, then the question is, okay, how optimum is your magnesium level? Not necessarily whether it's in range, but how optimum is it, right? And so, yes, the safe bet is to just supplement the magnesium, right? So so that was a very good question.
Dr. Bryant, I just want to put on the screen, Jamie had a follow-up question for you.
Okay, so would vitamin D more be more so for energy? Um, so vitamin D deserves its own sort of 1 hour discussion. Incredible things that we are now continuing to learn about vitamin D. But I can give you an example. Here's an example when it relates to energy, how it relates to energy. So I had someone close to me who was a runner, pretty avid runner, running, not a lot, but running a few miles a few times a week. And so, and then she caught COVID. And after that, she would start to have fast heart rate every time she started to even walk quickly. So whenever she started to jog, her heart rate would go up to 130s, and she would get tired and she'd have to stop. So she went to the cardiologist, had echocardiograms, EKG, had CAT scan to make sure there wasn't something like blood clot going on. And eventually, with supplementation of vitamin D, eventually, within 48 hours, that was resolved. So the answer is yes, it can help with energy if it relates to the root of the problem. In this case, the hypothesis, right, is that the theory is that there was this sort of leftover inflammation, and then supplementing the vitamin D, correcting that deficiency, helped, with that inflammation. And by helping with that inflammation now, well, first of all, there's less inflammation in the lungs, so that improves endurance, right? But that also improves energy, right? So when I think about vitamin D, I think primarily um, about reducing unnecessary inflammation, reducing exaggerated inflammation, whether that's autoimmune conditions, whether that's even sort of the risk factors for cancer and all of those things.
You have another one from Jamie.
Okay. So Jamie can relate. So wow. So Jamie says something similar happened to her. Um, wow, just got back into jogging. So after COVID, so this whole thing about long COVID, the question is that a disease or not, right? Is it a disease or not? Well, we know it is symptoms, and we know that there are signs involved, but the descriptions are, so we know that it's basically a medical description of something that happens to people. But the real question is, what is it, right? What is actually happening in the body? Why is it that people have this lag, physical fatigue, mental fog, et cetera, and what can be done about it? So, yes, so I'm glad that answered your question, because that's one of those factors that can be helpful um, in what some call long COVID, that can be helpful in leftover inflammation. Okay. And it doesn't have to be just from COVID, there can be other sources, like we get it all the time at the hospital for someone who's had pneumonia, for example, or bronchitis, or any number of things. And then, so you're at this level, you are knocked down, and then you never make it back to that level, right? So then the question is, okay, what are some reversible things that actually get you to that level? Simple enough question, right? So yes, that's one of them, right? The vitamin D with magnesium, don't forget, can be helpful, potentially, right? Nothing's guaranteed because everything's complicated in the body. Um, but it's nice to tackle things that are easy, right? Easy to be determined, right? Simple, and things that don't hurt when you're just balancing them out. So sometimes when those things fall into place, it seems kind of magical, but it's not magical. It's just drilling down to the root, of the issue. But that's great.
And, Dr. Brian, I'm in the background and I'm listening, and just like them, every time I talk to you, I hear something new. So you just said something is not magic. And you didn't use the magic word that you used with me, that I was balanced. And so I've been talking about you a long time because I had diabetes, everything. You saw my chart. I had a lot, and so some of the things had no cure, and your regimen that you gave me balanced me. And it wasn't just the supplements that you gave me, but it was also me being disciplined. So I wanted you to talk about, you they can take everything you're saying, but if they don't take care of themselves, then none of that will work, which I know you know that, but sometimes we don't know that.
Definitely true. Um, so if we were to sort of label all of the roots that a person sort of needs to their health, one of those roots is, sort of diet, exercise, sunlight, right? Sleep, spiritual health. You need people around you. You need basically love, right? These are all roots to what a person needs. And so, yes, there are some things that, that are a person's sort of responsibility to do and require discipline to do. I think that I went into this field, though, particularly for people who felt like they were doing everything that they could and were not doing it the right way, right? So if you're eating the best you can and you're exercising the best you can, and you're doing all of those, taking all of those steps, but if there's something that I could see that's like, oh my gosh, if you just a little tweak, if you just did this little tweak, then it could be make so much of a difference. Then that alone is the reason to get into this area, right? Just to sort of teach that part. So, and by the way, the example I'm thinking about relates to diet, and it relates to back 20 years ago, and even now, the understanding of macronutrients and the role of carbs, and um, the sort of fats were villainized so much, um, and understanding carbs, fats, and proteins, getting the ratios right, getting that balance right, which is actually where sort of came up with the brand of balance, which was balancing those, getting those right, correct, helps to prevent all of these issues, that we sort of think of as internal medicine issues, right? The sort of metabolic syndrome, insulin resistance, diabetes, high cholesterol, fatty liver, heart disease, and everything is sort of related. So many things are related to insulin resistance, and that's related to this understanding of the macros. So it was very sort of painful to watch people who actually were trying their best and um, achieving the wrong result. Okay, achieving the wrong result because there was so much misinformation. But yes, the point is well taken that it is, I think that's what we do in the medical field sometimes. We just say, okay, well, you work on lifestyle, but we don't necessarily fill in the details of how to do it or what that means. And so that's basically what I'm trying to do. Yeah. So,
Hey, Doc. Oh, go ahead. I'm sorry.
well, I didn't know. I was going to say I didn't know there are any other questions. Let's see if you point out any others.
I don't see any in the comments. You'll probably have some in the comments after the video is posted.
Sure.
I did want to share that he has a Facebook page. It's Ron Bryant MD. So if you are on social media, make sure that you're following him. I'll put his page up so that you can see if you search it and you're like, I'm not sure if this is the right person or not. I'll go ahead and share that so that you can see his actual page. Let me go back.
Well, while she's getting that up, thanks so much. So Dr. George has been awesome. But, there's just, it's a pleasure, to be able to reach out and to share. So I'm enjoying it.
He also has videos on there. If you go to his page, those of you that missed the live, it will be on the page. But he also has videos of myself and another client that told our testimonials. He also has one of he and I talking. He also has a YouTube channel. Dr. Bryant, I want to tell you thank you. Ms. J.D. Jackson said thank you both. Thank both of you. Very informative. And Dr. Bryant, I just want to say, I every time I talk to you, I tell you this, the same thing, that you gave me my life back. I can't, I don't think you understand to the degree that you gave me my life back. And I just want everybody to know, because as I said, and if they go watch those videos, those 2 boxes of pills I took, and you came along, and I'll never forget, you ran into my room, knocked on the door and said, you've been up since 2:35 because you had to see the lady. You thought I was like bedridden or not. You didn't expect me to be able to sit up and be like, hi, I'm okay. So I remember that statement that my chart did match the lady in the bed. And I thank you for your belief, your faith, and just your being personable You're more than a doctor to me. You're a friend, Dr. Bryant.
Oh, well, thank you very much. Thank you very much. I just want to also close and say, you know, see your physician. Let this be sort of food for thought to you. Not a sole sort of um, stream for your medical advice, but just know that a person should have actually the tools that they need to be able to play a role in their own healthcare, right? So that's part of the goal. And so, yes, Belinda, Dr. George, thank you very much. And so I think you're a great example of that. So thank you once again. So enjoyed it. Thanks, everybody.
Okay, guys, I did put a question in there, things that you want to hear that Dr. Bryant, he can come on and talk about. So make sure those of you that are watching later that you share this. If you're watching now, share this, and also go ahead and put things you'd like him to talk about. He's a walking book. So put those in there so that he can address the things that you guys are interested in hearing about. Thank you so much for joining in, and thank you again, Dr. Bryant.
Thank you. Thank you very much.